What about neck crackers? I can't even do it, but if people who crack their neck, is that a sign of anything? Or?
Not really. Normally the cracking or when you have the joints that they knuckle or the knuckles like go like this, basically that's a sign of nitrogen bubbles that are being developed within the joints that they're popping out. Nothing to be scared, nothing to be worried about. It's a mechanism of our body telling that there's already some wear and tear already. So, but that doesn't cause any problems, or if you hear it, you don't have to worry at all. Normally patients, they normally complain of that when they come to the office. Oh, I'm starting to hear my neck cracking or my back cracking or my shoulder. Normally, a lot of time when you have it, I bet that you might have it elsewhere in your body. The thing that your body's just, or your brain is more focused in the area that you might have the symptoms. So that's why if you have a neck problem, you're gonna tell me in the clinic, I have my neck is cracking. But most likely your knee might be cracking at the same time.
Now, what about this, Dr. Menendez? This is actually just a quick question. What if there was an incident and you felt your neck pop or crack?
That's different. Then that might be a ligamentous injury that might be going on, and that's a different story. That's a good point. Yeah. If someone is having more a chronic rather than you heard it at the same time that you developed the pain, that's a different story.
That's when it's serious.
Let's, since we live in South Florida and we're probably, look, born and raised in Miami, but probably the worst drivers ever here. But there are fender benders. We've all been in them, and you get that. When will you know if you have neck injuries from something like that?
Normally, you will get the neck injury. A lot of people, they don't feel it immediately once they have the car accident. So they normally will start reporting that several days after the car accident, maybe the next day or 48 hours later. And normally, when you're in a car accident, you have the whiplash, so you go like this. So most of the times, the most common thing that gets affected are two joints, or it's a pair of joints that we have in the neck called the facet joints. And most specifically between the fifth and sixth, that's the number one, and between the second and the third, that will be the number two joint that normally gets affected. So normally those joints, although we don't see that on MRI, we have cadaver studies that they show that they have some ligaments, meniscus. It behaves like the knee, and they can have blood as well inside, and all those can cause pain.